Okay, good morning, everyone. I'm Mike Stratton, Communications with Boulder County Public Health. I'll be moderating today's call. A few housekeeping items to get us started. We'll have all attendee lines on mute throughout the call. Once the comments at first are finished, we'll go to the Q&A. Please raise your hand using the little Zoom raise your hand button. You can also put a question in the chat. If you are on the phone, we'll reserve some time to get to your questions as well. We'll hopefully get to all the questions. If we do not get to your question, you can please send us an email afterwards to Chana Gusettis. I think most of you know her. Her email is cgoussettis@bouldercounty.org. And as a reminder, today's call will be recorded. You can request a copy by emailing Chana. So with that, we will get started. We may have a couple people who still need to mute. Appreciate that. So here we go. On today's call, we will have Jeff Zayak, Executive Director with Boulder County Public Health, along with Phil DeStefano, Chancellor at CU Boulder. We'll also be joined by Chana Gusettis, Public Information Officer with Boulder County Public Health, Patrick O'Rourke, Interim Executive Vice Chancellor and Chief Operating Officer with CU Boulder, and Russell Moore, Provost with CU Boulder. Now I'll turn it over to Jeff for some opening remarks. Thank you, Jeff.
Thanks, Mike, and I'm sorry, I'm not sure why my video is not working this morning, so I apologize for that. So what I want to do today is just take us through where we're at right now and some of the things that we've put in place recently, and then I'll turn it over to Chancellor DeStefano. So the situation and where we're at right now is we have 1,392 confirmed or probable positive cases. This was as of yesterday among University of Colorado Boulder students between the ages of 18 and 22 years of age since August 24th, 2020. So that's obviously a big concern for us. We're still seeing an increase in cases. And we know that the biggest challenge at this point is coming from off-campus collegiate group homes, and specifically social gatherings of the 18 to 22-year-olds. That is representing the majority and significant source of COVID transmissions in Boulder County right now. So we issued, as you all know, last week a 14-day self-quarantine. But we're still seeing evidence of gatherings in violation of the existing orders. Even though we have seen a reduction in the number of gatherings, we are still seeing evidence of gatherings in violation, again, of existing orders and of the self-quarantine that was sent out last week. So because of this, and with support from the Colorado Department of Public Health and Environment and the Governor's Office, we've issued a public health order that focuses in two major areas. The first, and the one that is extremely important, is prohibiting gatherings of any size within the city of Boulder that include any person or persons between the ages of 18 to 22 years of age. And again, that's because our data is clearly demonstrating that the majority of our outbreak is in this age category. Also included in the stay-home order is a stay-home order that's been issued to 36 properties that are where we've identified unlawful gatherings and other public health order violations that have occurred, which also pose a significant threat of disease transmission due to the behavior of those occupants of those dwellings. The order will go into effect at 4 p.m. today, Mountain Standard Time. And it will be in effect until October 8th, 2020, unless we choose to extend or modify it. And we will be looking at the data to determine if we will extend or modify the order itself. One thing I wanted to say to anyone who may be watching is that the success of this is going to be relative to individual behavior change. We know that. We know that this This age group is generating the majority of the challenges right now, and this age group can absolutely be part of the solution. And it's going to come down to everyone taking responsibility for that individual behavior, so that we don't force our community into a place where we have to issue other orders, or we have to put our county in a place where we damage our economy or exacerbate social and behavioral issues that we know can occur with stay-at-home orders, or cause potential serious and life-threatening health impacts for those who are most at risk. And most of all, reduce our quality of life. So we need to solve this problem together. We can do it. We've got to have a commitment from everybody in the community to keep moving this forward, but we can be part of this solution together. And it's going to be critical in terms of those individual behaviors as to whether we are successful moving forward or not. So I will, at this point, turn it over to Chancellor DeStefano.
Thank you, Jeff, and good morning to everyone. We've been working closely with Boulder County Public Health. They've kept us informed as this order was worked on and finalized. We understand and support the steps Boulder County Public Health is taking, and we view our role as needing to be supportive of our students impacted by this order. With this firm restriction on gatherings for all 18 to 22-year-olds in Boulder, we are focusing on the virtual events that we can create for students and any other support that they may need while they experience college life in such an altered way. We're also seeking every avenue to provide students and faculty flexibility at this time. We're currently in a state of temporary remote instruction for all classes. This began on Wednesday and is scheduled to continue until at least October the 7th. In a message that I sent to the campus this morning, I informed the campus that students may select to remain in a fully remote status for the remainder of the semester. Some students are eager to return to in-person learning, and we will do our best to get them back to in-person safely. Other students have told us that remote learning is the best option for them. And if they want to stay with remote learning for the rest of the semester, and we'll make that option available to students. So thank you again for joining us today, and I'll now turn it over to our moderator.
Thank you, Chancellor DeStefano. We'll start the Q&A now. As a reminder, we've only got about 45 minutes for this entire call, so if we don't get to you, we will answer you by email afterwards. If you have a question, please raise your hand in the Zoom function, and we will get to you. Otherwise, please put something in the chat, and we will call on you there, and we will get to phone calls as we go along. So the first question we have is from Elizabeth Hernandez. I'm going to ask everyone to please give their name and their media organization when they ask their question. So please go ahead, Elizabeth.
Thanks. Yeah, this is Elizabeth Hernandez with the Denver Post. I am wondering if someone can explain what enforcement of this will look like, particularly helpful for students to understand. Like, will you be patrolling campus, breaking up groups of like 2 people standing together, or what can students expect for enforcement?
If Kate or Trina are on the phone, I'm going to see if they can answer that for us. These are my county attorney folks.
Absolutely. Thank you, Jeff. Yes, this is Kate Haywood with the Boulder County Attorney's Office. With respect to enforcement, I would like to note that violations of public health orders are considered a Class 1 misdemeanor under Colorado statutes. Public health order violations also violate the City of Boulder Municipal Code, which carry penalties up to 90 days in jail and a $1,000 fine. And then public health order violations also violate the CU Student Code of Conduct and can subject students to discipline by CU. Public health is working closely with the City of Boulder, CU, Boulder Police Department, and CU Police Department to coordinate enforcement efforts, which will include patrolling high-risk areas.
Okay, thank you. Our next person in line is Paolo. Can you please tell us your name and your media organization, and give us your question.
Yeah, hi. This is Paolo Zialcita with CPR News. I wanted to know, how were the 36 stay-at-home residences identified, and why are they specifically being called out?
This is Kate Haywood with the Boulder County Attorney's Office. I can answer this question as well. The 36 properties that were include addresses with documented public health order violations, as well as off-campus collegiate group homes, which public health has determined represent a significant source of COVID-19 transmission in Boulder County, both among residents and visitors.
Okay, thank you. Elizabeth, it looks like you have a follow-up question. Please go ahead.
Yeah, is there any indication at this point how many students have left campus? I know I've been trying to find out how many students in the dorms started and how many have left at this point. Any indication of either of those students in dorms or in general have left at this point?
And I'll ask Pat O'Rourke to take that question.
Sorry, Elizabeth, I don't have an exact number on that. The last number that I remember hearing was somewhere in the neighborhood of 260 students who had asked to be able to leave their residence hall contracts, but I'll follow up with student affairs and see if that number has increased.
Yes, I believe it was between 250 to 300, Elizabeth. And that's from the beginning of this semester.
Do you know what time frame from the beginning until last week or this week or?
Actually, Elizabeth, I just received a response. We have had 374 housing cancellations through this week.
How many?
374.
Thank you.
All right, thank you. We have a question in chat from Melissa Korn from the Wall Street Journal. What happens if case numbers continue to rise over the next couple of weeks? For Chancellor DeStefano, is there a point at which the school would pull the plug and send everyone home to finish out the term remotely?
At this point, we don't believe it's wise to send students home. However, we would have to assess that as if things get worse. But at this point, I think from a safety standpoint of students going back to their communities, I would not recommend at this time that we ask all students to leave. However, we will have to reassess that in the next 2 weeks. Pat, anything else?
I would just add that the indication that we have received from the governor's office and that you saw in Governor Polis's messages last week is that the sending people home could actually lead to an increase in disease spreading to other communities. We want to be in a position to work with the county in order to avoid that. And that even those schools that have switched to fully remote instruction have continued to have large populations of their students living off campus. As Executive Director Zayak mentioned earlier, those are the student populations where we've been seeing the highest rates of concern. And so we want to be in a position where we're actually trying to help take action that will mitigate the spread of disease, and that we've seen after, based on what other schools have done, like Notre Dame, that have implemented similar type of measures, that they're seeing a reduction of new infections. And we're going to focus all of our attention very sharply there in order to be able to address the incidence of infection in the ways that are most effective.
Okay, thank you. We do have a question in the chat from 9 News. Janet, she says, follow up to the earlier question, how will enforcement work as it can be hard to pinpoint someone's specific age?
This is Kate Haywood with the Boulder County Attorney's Office. We would need to defer to the Boulder Police Department, and we have been working with them closely in terms of coordinating enforcement, and will continue to do so as any enforcement challenges arise, but we would largely defer to the Boulder Police Department.
Okay, thanks. We have one more question from the chat, and then we'll go to the phone lines. Aaron Trader from the Colorado Springs and Denver Gazettes. Have there been any fatalities among students with who had COVID-19, any hospitalizations? Can you tell us that?
Pat, would you take that one?
Yes, so there have not been any fatalities that have been COVID related among students. We did have a student who passed away last week due to other non-COVID related causes, and we're very sad and send our condolences to their family. I believe that we have had one student hospitalization that I'm aware of through our medical services with a student who has recovered.
Okay, thank you for that answer. We're going to open up the phone lines. If you have a question, you're on the phone. Would you please speak, give us your name and your organization first. Okay, we'll go back to the Zoom questions. Taylor Summers, can you tell us your organization and what your question is?
Yes, Taylor Summers for NBC News Radio in Denver. I was curious about how often students are being tested, if they're in some of these residences that are now under stay-at-home, and if that testing will be mandatory.
This is Jeff, and Jeff Zayak with Boulder County Public Health. So we've made available a walk-up testing site and have done outreach directly to students to encourage them to go get testing at this point. The majority of, and I don't know the numbers right offhand, but the majority of the folks who have been tested at that site are students. So we are seeing student uptake on the testing site that's the walk-up site. We have not required mandated testing at this point, but we'll continue to test at that site until we see the positivity rates drop at that site relative to students getting tested.
Okay, thank you, Jeff. Let's try the phones again. Do we have anyone on the phone who has a question? If so, please give us your name and what your organization is. Okay, it sounds like not. We currently do not have any more questions in chat, or no one has raised their hand. I want to check. Do we have anyone else who's got a question out there?
Yes, I have a question. I was reading in the, my name is Johan Castellanos from Telemundo, and I was reading in the ordinance, and it states that the fines, they can go up to more or less $5,000, but I heard that it was $1,000. Can you guys give me more information about that? Fines and jail? One time?
Yes, absolutely. This is Kate Haywood with the Boulder County Attorney's Office. I can clarify that. The $1,000 fine limit, that relates to violations of the Boulder Municipal Code, whereas the $5,000 fine relates to public health order violations under Colorado public health statutes.
And just because it says at the end, it says that they can have imprisonment until 18 months. Is that right?
Yes, so the 18-month imprisonment and the $5,000 fine, those both derive from the Colorado public health order enforcement statutes, and the $1,000 fine and up to 90 days in jail, those relate to violations of the Boulder Municipal Code. So what it would boil down to is whether the violation is being enforced via the Boulder Municipal Code or the Colorado public health statutes.
Thank you.
Hey, thank you, Kate. Elizabeth Hernandez, looks like you have a follow-up question.
Yeah, is the state data on COVID-19 numbers and using CU as saying that they're the largest outbreak in the state, is the state data the most comprehensive that we know of? I know there's some discrepancy of like who CU counts and who the county counts. So can you clarify which numbers, are kind of the most comprehensive in terms of case numbers?
I believe Emily Payne is on the phone, who's my data specialist and epidemiologist. Emily, can you take that question?
Absolutely. Hi, this is Emily. I would say we are working very closely with the state on those numbers. In fact, we sent them a line list earlier this week to be able to create that new data point. I would say that they do update their website on this outbreak once per week, and our website is updated with new graphs twice per week on Mondays and Thursdays. So I would look to our graphs on our website that are posted on Monday and Thursday for the most up-to-date numbers, since that one is only updated once a week.
Okay, thank you, Emily. We do have a new question from Jesse Aaron Paul. Would you tell us your organization and your question, please?
Sure, it's Jesse Paul at the Colorado Sun. I know that we're still kind of in the middle of this and you guys are still responding to the crisis, so it's hard to do Monday morning quarterback, but it feels like this is kind of the worst case scenario that could have happened with welcoming students back. I'm wondering if you guys could comment a little bit about how we got here and where this kind of ranks in terms of your contingency planning and kind of everything apparently failing at this point.
So Pat, would you take that?
Sure. So I appreciate the question, Jesse. We knew from the beginning that we were likely to see COVID infection within our community under any circumstances. Even those schools that have decided to operate fully remotely for their semesters, like Washington State, have had significant COVID outbreaks because of the fact that the student population generally lives in the community. And we focused our time and attention on trying to be able to create the conditions where we could have people return safely. In a lot of ways, we were successful in doing that. We think we did a good job creating good classroom environments, and we think that we were able to address a lot of the environmental factors. We always knew that we might have to shift to remote learning and take other measures. I think that what we realized is that notwithstanding the fact that the students told us that they wanted to return and that they needed to return in order to be able to further their education and that they wanted to have this experience, we needed to be able to think about the behavioral issues and be able to think about what the tools that we could use in order to be able to address those most effectively so that we would be in a position to be able to do that. And so we've responded in terms of our behavioral expectations, responded in terms of being able to think about enforcement, and really strengthened our partnership with the county to be able to think about all of the mechanisms we have to be able to address the behavioral challenges. And that's the position where I think we're learning and improving daily, but that we would want to be in a situation where we're responding to what we see. And we're learning. I think the collaboration that we're seeing with the county and with the city is improving. Yesterday, Executive Director Zayak said we would have liked to have stood up that joint command structure a little bit earlier, but we've got it in place now. And we're seeing some of the payoff on that. Our positivity rates over the past week have significantly gone down with our testing of the on-campus students. And we're confident that we can continue to bend the curve back in a direction that will be not good for the campus, but good for the community.
Great, thank you for that answer. We do have a question in the chat about getting a recording of this event. There is a email in the chat for Chana Gusetis. You can send her an email. We will also have this on the Boulder County COVID-19 website, and I'll link to that there so you can look for that. We have another question from the chat. Michael Kanopasek, sorry if I've butchered that. Fox 31, for CU administrators, knowing what you know now, should CU have gone 100% virtual from the start of the semester? Had the advice been provided to you all from health experts prior to semester starting?
Well, I think as Pat said, and to the last question, and I'll turn it back to him in a minute, but we heard from our students that they wanted to come back to campus. They wanted to have an in-person experience. And of course, the health and safety of the students, that was our primary, that was our top priority. And we prepared well. And as Pat said, we knew that there was going to be a spike. And what we're seeing now, and if it continues, I believe that in the next, and what we're seeing now as far as the decline in cases, infectious cases, that if we do what the county and the city and our collaboration with the collaboration with the university have worked on, I'm confident that we're going to see a significant decline in the next 2 weeks. We knew this was a high probability, but at the same time, we knew that our students wanted to be back at the university, especially our first-year students. I'm pleased so far with how things have gone. As I said, we knew we would get this spike. The students, for the most part, have been very responsible and very accountable to wearing masks, social distancing, and so on. And I believe that that will continue, and we'll see a bending of the curve. Pat, if you want to add anything.
So I would actually like to ask Russ Moore, who's our provost and who is indeed a scientist himself, to be able to address that question. But to address one thing specifically, the advice from health experts, including our epidemiologists, environmental scientists, and others, was that it was achievable for us to be able to return in the fall semester, and we followed their guidance. But I think that Provost Moore would probably be in the best position to be able to talk about that process and how we made the decision to not start virtually from the start of the semester, relying on the scientific evidence.
Yeah, thank you, Pat and Chancellor. I believe we did take the guidance from the best epidemiological expertise that we had available at the time. And we also built the responses to the eventuality that we might have a spike in COVID cases. And we have responded, and in partnership with the county, we do believe we're getting good results on campus, and that we can return to the normal operations that we had at the beginning of the semester. Our students do want the on-campus experience. It's part of their social development. And we also believe it's important for their mental health to be able to have that socialization. That said, we're on this 2-week period where we're going to try to continue to bend the curve down, and hopefully we'll resume operations. Other universities have used this pause strategy quite successfully, and we have every reason to believe that this will be successful as well, in partnership with the county.
And I would just add one last piece to Russ's answer, which is that we did discuss our intentions with the State Department of Public Health. The State Department published guidelines on what they believed should be the practices that institutions of higher education across the state would follow. And we are met or exceeded all of their recommendations. So we did take that into account, and this was not just something where we did not have the support of our local health agencies and others for the planning that we did, and we appreciated their guidance and consultation.
Okay, thank you. Let's try the phone lines one more time. Does anyone on the phone have a question? Please let us know your name and what organization you're with. Okay, moving back to the Zoom questions. Jesse, I believe you have a follow-up question. Could you please again state what organization you're with and your question?
I'm sorry, I just didn't put my hand down before. Okay.
Okay. Paolo, can you tell us your follow-up question, please?
Yeah, I'm wondering what this new health order means for local businesses and restaurants that rely on the business of students. Does going to a restaurant alone to pick does that, and seeing other students, does that count as a gathering?
Kate?
Hello, yes. So a gathering constitutes any group of persons that involves any 18 to 22-year-olds. So unless an individual lives at one of the listed properties and is subject to stay at home, they can go about their business individually, but they cannot go along with anyone else.
So are bars essentially closed for 18 to 22-year-olds?
So 18 to 22-year-olds, so long as they are alone and not subject to stay-at-home requirements, they can go to any business.
All right, thank you, Kate. We have another question in the chat from Michael Konopasek. I'm not sure what organization you're with. He asked, how does CU compare to other universities of similar size from across the U.S. in terms of cases and positivity rate?
Russ, is that one that I'll put to you?
Yes, I can take that one. Many of the universities have different testing standards, so it's not an apples to apples comparison. But with that said, I believe we're in the similar ballpark to other major universities. One of our comparators with whom I collaborate with on a weekly basis would be the University of Arizona. We're not quite as high as they are. Then there's University of Illinois, and how they report their positivity cases. Again, it's a difficult comparison, but I think we're comparable. And if you look at how we're trying to maintain our modes of operation, I think we're all comparing and using, trying to compare our best and most effective strategies so that each of us can implement them accordingly. So with that said, I believe that we're on a good, once again, I believe we're on a good trajectory, particularly with respect to the management of the cases on campus. So I believe, with the partnership with the county, I believe there's hope for optimism with respect to controlling this off campus as well.
All right, thank you. We're going to go to final questions from the phone and a few final comments here in a minute. If you do have a question, otherwise please put it in the chat or raise your hand in Zoom. So once again, anyone on the phone, questions? Okay, looks like not. Any other questions here in Zoom from anyone? All right, looks like we are done with that. Chancellor DeStefano, would you like to have any wrap-up comments, and we'll follow that with comments from Jeff?
Sure. Thank you very much. I just want to stress again the importance of the collaboration that we have with the county, with the city, and the state, and how we're working together to bend this curve at the university. We've fully supported, we're very supportive, fully supportive of the decision coming from the county. We'll work closely with them, and I believe that we'll see a significant change in the number of infectious cases based upon this order. So I want to thank Jeff and his team. Certainly want to thank our City of Boulder and the state. So thank you very much.
Thank you, Chancellor. Jeff Sayak, would you like to end this call for us, please?
Yes, thanks, Chancellor. And I want to make a couple follow-up comments. The first one is that the plea to make sure that that everybody take responsibility, because this will make a big difference for us. As we move forward, our success is going to be based on the actions of those individuals and taking those behaviors seriously. And again, I know that our students and our community is up to this. We've demonstrated this up to this point. And I know that we can do this with this issue that we have in front of us. So my plea to everyone is to please follow those orders. Mask, social distance, please do not gather, good hand hygiene. And we have to remember too that with this order going into place, it's going to take a couple weeks because we have incubation periods in place that are anywhere between 14 days and less. So we are going to be looking over this next 14 days to see what kind of impacts we're seeing, both from a behavioral standpoint as well as from the data standpoint. But we can make a difference if we all take responsibility, and I urge everyone that's listening to take that responsibility. Thank you.
Thank you, Jeff. We're going to wrap up the call now. Once again, if you do have questions, follow-up, requests for the video, you can contact the Boulder County Public Health PIO, Chana Gusetis. Her email is cgoussetis@bouldercounty.org. She's also listed in the press release that went out first thing this morning, so you can find her there. And with that, thanks everyone for joining us.